explain in a very brief nutshell sort of who you are, what you do, and what brings you to today? You know, what your real mission is as it stands in this moment in time.
Yeah, so I'm Dominic,
Then.
and yeah, it's an easy question, isn't it? Why are we here? No, I'm a doctor. I've been a doctor for 8 years, and obviously trained for 6 years before that. Cardiology registrar, and then seconded into ITU for the pandemic for a little bit. And sort of how we got here, I suppose. So one of the things at the beginning was quite concerning was there was how shall we say, a lack of foresight perhaps with some of the government policy, which just didn't make sense. And I'm not an expert. I've done some infectious diseases before. I'm a doctor, but and I'm on the ground, but I'm not an expert, certainly. I would say I'm an expert in NHS capacity because I spent about 6 or 7 years complaining about it and campaigning about it. So the beginning of the pandemic looked pretty nonsensical to me. And interestingly, I know personally some people on Sage and was having sort of quite funny conversations indirectly with them, which didn't really quite add up. So when it started kicking off a little bit, we were trying to get on the news and campaigning for earlier lockdown in that first 2 weeks of March. And then when that did happen, suddenly had this gap of, well, where does all that energy go now? My wife's a doctor as well, and we're sort of crawling up the walls. So we started this charity. We called it Help Them Help Us, or Heroes, and quite quickly found lots of niches and needs, and very quickly connected with the PPE issue, which was the biggest one. And then from the PPE issue, we expanded out to, and that's how me and Kadeen met up through SHIELD. Through SHIELD was my other love of acronyms. So HEROES is an acronym. It's Healthcare Extraordinary Response Organisation Education Support. And SHIELD is an acronym, but embarrassingly, I now can't remember what it stands for. I think it's Sustainable Hubs for Innovation, Emergency, and Something Development. But the point is, it was a collaborative enterprise to just try and get stuff done. And it was a very nice thing to do because everybody was pulling in the same direction. So we had this idea that, everybody wanted to respond, everybody had expertise, and everybody also was at home and not doing very much. So it was like the ideal way to start to kick off something. So from my point of view, we were testing the stuff. I met up with Nate originally for Makerversity, but then that expanded out into 3D printing and also contacting contractors to deliver PPE as well and testing that stuff. But the whole drive really has been a creative outlet, I would say, more than anything else. Medicine is very much very, very linear, and sometimes linear to the point of there's no point to it. We do a lot of hoops, paperwork, especially in training, which don't go anywhere. So it can be actually quite difficult sometimes. Whereas this was something that, needed a lot of energy. There was a real need, but also a lot of open road. I mean, a lot of places to go where actually, the regulation was coming away, the procurement law came away, and it was just about what do we need right now. So in many ways, that was a very rewarding way to move forward. And then, to surround yourself with like-minded people who want to innovate and want to do things, and, created some great results. So we got to the point of a accredited 3D printed visor, which I've actually got here now. So this is
amazing.
BSI approved. So the headband here is 3D printed, and then this shield is laser cut. And then this is actually a tourniquet that we use in hospital normally for taking blood. This is actually a newer design, actually. It's not the one that's accredited, embarrassingly. And so that took about 6 weeks to inception to produce, and then getting those into hospitals. But I actually wore the prototype in my ICU for about 6 weeks. And the whole purpose really was, as a small charity, a grassroots organization, we could never meet the demand. The demand for PPE is about 1 billion sets a month in a pandemic. So even with £1 million, which is beyond what we'd raised and some other organizations had raised more than that, it wouldn't touch the size if you just bought it. So the purpose really is to say, well, what can we do that the government can't? And one of the things that we can do is reach out, innovate, and create reusable and sustainable stuff. And funnily enough, I was talking to a friend of mine who's a GP, and he's like, well, the demand for PPE has gone down because we've all still got the same stuff that we had 3 months ago because we don't have to throw away. So they're all reusing it. And actually, if you could, in theory, cover every healthcare worker quite quickly if they all had kit that could be reused every single day. and that was, you know, the real ethos there, and you know, what's borne fruit. So we've also got reusable gowns. I'll show it to you, although it's just a big sheet really. So this is a reusable gown.
What are they made of? What material?
This is made of 65-35, some sort of very thick cotton, I think. But the outside is treated with a sort of plastic, so it's sort of waterproof, but then reusable and washable as well. And also we make scrubs through another group called So Sussex. So between those sorts of strands and exploring some bit more fringe stuff, decontamination project where we're going to hopefully refit a shipping container into a decontamination chamber that can be dropped off at hospitals. The funny thing is, because we were reacting on a sort of slope where everything was going up and then we plateaued and there was a demand, and now things are going down, it's a little bit of transitory what we do next. My gut feeling is that we should just pretend that the pandemic never happened, but we know another pandemic is going to happen, and what would you do? And in that circumstance, what you do is you create the surplus that you should have had to start with. So even if we keep pushing on and make a surplus of stuff, or even change the conversation around PPE, then I think that's mission success, if there is a second wave or not.
What sort of, in terms of the collaborators, you know, can you tell me a bit about the sort of wide range of collaboration that was necessary to innovate so rapidly?
So I think initially the first collaborator, as always, all these great collaborations, was Twitter. So I put on Twitter that I was interested in 3D printing, almost as not as a hobby, but almost as it definitely wasn't a serious consideration of what we should do with PPE. Yeah. But someone hit me back straight away, and that was Nate Petrie, and they're from a group called Makerversity, which is just a whole bunch of innovators and engineers, basically self-contained businesses. And they already were sort of quite developed actually with the projects, lots of different things to respond and what they can make. And then we got some funding quite quickly, and we set up this 3D printing farm. And alongside that, I was contacted by a guy called Paul Ford, who had already started trying to source PP from industry. And then another group called Med Supply Drive, and they're clinicians. So Paul Ford is a contractor and actually a chairman of a conglomerate of contracting companies. So he's, you know, industry, knows about PPE from the industrial side, and there's loads of it. And it's an industrial standard, not a clinical one. So the stuff is, you know, especially the filtered masks and things, it's the same stuff. It just doesn't come in a shiny package, basically. And then expanding from there to engineers. So there's a group from Helpful Engineering, other 3D printing, such as Kadeen groups, and also lots of people just, you know, logistics, a few procurement specialists. So where this all started actually was I got a phone call on, I think, Tuesday, March 17th, so before lockdown, after I've been on telly sort of complaining about the lockdown, and from an anaesthetist in a hospital in Derby, and she's a clinical procurement anaesthetist, and she's on a day off, and she was trying to source 30 million masks from China, and that was her first thing she said to me. So I can get 30 million masks from China, we should probably try to do that. And I was like, we should try to do that. And she also said, oh, and also, you know, I've got a contact that's looking for funding for a vaccine. And this was at a time when no one was talking about vaccines. And I was like, well, if you're doing this on your day off and everybody's on their day off, well, what can we do with that energy? And that's kind of where a lot of this started. And that led to, you know, very funny conversations, talking to the cabinet office and talking to experts in procurement law, and just sort of reaching out into the world when the world was very receptive, I suppose, and finding that lots of open doors. So all sorts of people, I mean, lawyers as well have come on board. And
was there anyone that you were surprised came on board, or sort of looking forward, you thought, I wish we had someone with X skills or X expertise?
So actually that's really good. So what it took me a long while to realize was project management. Now, I come from a background where there's no such thing as project management, and the only project managers you ever see in hospitals are a complete waste of space, if you ask me, because they're always trying to do something that nobody else wants to do, and they're not connected. But what you actually need especially in a situation where you're trying to move very, very fast, and I didn't appreciate this at all. So we just started, basically, me and Nate, building this 3D print farm. And it took me about 3 weeks to realize that when I asked like basic questions, like, how many masks do we have? How much kit do we need? When do we need it by? There were no answers. And that's when I realized that actually there was a real gap there, that actually right at the beginning, if we'd said, okay, we need X, Y, and Z. Here's the expertise. Here's the clinician, and who's going to, as my, you know, my wife's cousin always says to me, hello. Who's going to hold the pen? And
you need a producer,
someone to hold the pen on things. Well, exactly. Someone who can, you know, play all the cymbals, and it took a long. I mean, for me, it was for me for a while, and then somebody else, and eventually it spun up, and somebody appeared into that role. But right at the beginning would have been the ideal, just to keep things organized, and keep the phone calls going, I suppose.
That's really interesting, because in sort of this area of cross-discipline collaboration, project managers, producers, they don't get much of a sort of position, do they? And we don't sort of look at them. And it's interesting what you say about the energy needed. So what do you think the mindset really is within that, from what you've learned about the collaboration in terms of, you know, being agile, being creative, being responsive?
I think I think that it's funny, because initially there was a real, let's just do something energy. And then as soon as that, and this was quite interesting from my side, because I'm completely outside the field, as soon as it came to dealing with the usual stuff, so like industrial paperwork, for example, or regulation paperwork, or order forms, everything would instantly slow down, because people went back into the same ruts. And what I came onto conversations, and I was like, but what, you know, we need this right now. Like, there's no point doing the paperwork for approval for a product that we don't need in 6 weeks. And it was interesting that there was almost not tension, but almost like people go, oh yeah, because, you know, my day to day is going and not finding the stuff at work. So I was only really fixated on, we need to get the stuff and we can sort out the lawyers later. And interestingly, I have to say, both of those, and this is probably what I would do in the future, is realize that it's not either or. In a pandemic where you've got a response, you need an acute response, like now, you need a short-term response, you need a mid-term response, you need a long-term response, and you need a plan if it happens again. And you need to start all of those streams at the same time. Because if you try to do one and then switch over to the other, you have to start from the beginning again. So even though I was quite like, let's ignore all of this, some other people very wisely ignored me and started the process for approving. So when the government changed the guidance a couple of weeks ago to say you must be submitting approved PP product, we had it ready because we'd already done it. And it wasn't because of I wanted to do it, it's because other people said this was a good idea. So it's interesting to, you know, when you're in an innovative situation where you have to respond to a problem, to not just have one vision, but to have, you know, 5 layers of the same vision and say, what do we need tomorrow? What do we need next week? What do we need in a month? And actually realize that because it's such an exponentially changing problem, if you start something midterm solution halfway through, then you've already lost. And just trying to balance, and there's quite a lot of tension. You know, people say we can't just do that, and you'd be like, well, why can't we do that? And then they'd be like, okay, we can do that, because really, actually, a lot of the things that we do day to day, we don't really think about. It's just what we do anyway, day to day. So I think sometimes in these situations where you have lots of multidisciplinary people, someone running it who doesn't really have a clue what they're doing, but is quite good at like seeing where we should go, is probably the most useful person, as long as they've got a thick skin, because they can then coordinate and have that oversight. But also they can challenge, you know, when people say we have to do it this way, you say, well, why? And you haven't got an answer to that. It encourages that, you know, that sort of breakthrough tension, I suppose.
Hello. I'm hoping through the power of technology you can all see me and that we are live. Welcome to everybody to the MedTech Revolution, part of the incredible Immersive Kind series of symposiums looking at the cross-discipline innovation that comes when you combine creatives, technologists, medics, and beyond, and a will to do good and create progressive work. So we're here at the beginning of our future series, MedTech Revolution, which will be spread out across the next month. The reason we did this series was in response to the current climate. It has been a time of uncertainty. It has been a time also of amazing innovation. It has been a huge challenge, but also shown humanity at its best. And one of the most incredible things about it was, yes, we may well have been unprepared, but in the time that commenced, everybody rallied together and we saw an incredible acceleration of innovation in the medical technology space. And we want to discuss that today. We have voices from across the medical technology space, people who have led pioneering work at this time. And we also want to ask the questions from you guys. We want you to be a part of this. So I will quickly show you the platform that we're on, Crowdcast, how it works, and then we'll hear from the founder of the Immersive Kind, Kadeen. So welcome to Crowdcaster. It's a very unique platform. You will see around you on the right-hand side a chat box. Now, everybody can see that chat box, but please, this is a discussion, so use it, whether you want to ask a question of me, of each other, or just general chat. At the bottom, you will see a tab called Ask a Question. Please do ask questions. That's what this is all about, a chance to actually interact with the amazing specialists and experts we have today. You can also vote for questions as well. When somebody puts a question, you can vote for it and it goes higher and higher up on the list. We have a special shout out today to an amazing number of students who have joined us from across East London, so welcome. We would love you to, this is through the initiative Stadium Learning. We'd love you to fill out a poll as well, which I know the one from Dr. Anna Chapman will have sent you. At the top of your screen, you will see on the left, it will say session 1 and session 2. We are now in session 1, which is the panel Q&A. That will run till 6. At 6 o'clock, we're going to move to session 2. There'll be no video or no live video, but it will be a chat room where our experts will be able to remain for a little bit. There will be all the members of the Immersive Kind. And there will be an opportunity for you to ask them questions, talk to each other, and continue the discussion. We can be found at the tab at immersivekind.com. So do check us out. We will be doing design briefs, round tables. We have events all around this series. So this is just one in a huge, huge series. This first event was called Disaster Preparedness Kit. There's been a lot of talk about how we weren't prepared. We had another person who's collaborating us in this series, the wonderful Dr. Dominic Pimenta, who spearheads with Kadeen the SHIELD initiative on PPE, as well as Heroes. Now, he said something yesterday in a roundtable we had, which was really interesting. He said, preparing for pandemic before the pandemic seems alarmist. Preparing for the next pandemic seems inadequate. So that's what we're here to discuss. What can we do? What have we learned? And what should we take forward with us to make sure that we grow and we progress from this situation that we're in? That we see the opportunities that have come together, the collections that have come together, and we make this a useful step in our evolution as society. So I'm going to bring one by one the speakers that we have today up. They're an amazing collection of people. Each one of them is going to take a couple of minutes to talk a bit about their work. And tell you, what they're up to and how they've been an important part of this. Then we will bring them all back on for panel discussion, which we really do want to be your questions. So start asking them and do ask any question that comes to mind. So first of all, we have the incredible Carrie. Now, Carrie Shaw is from Embodied Labs, an absolutely revolutionary immersive training platform using VR in the healthcare space to train people, to prepare people. So if we could bring Carrie up, she will talk a little bit about her work. Carrie, hello, it's wonderful to see you. I can only give an inadequate introduction, so I will leave you to do an introduction for yourself and tell everybody a bit about your incredible work. So thank you.
And hello, everyone. It's so great to be here with you today. My name is Carrie Shaw, and I am the CEO and co-founder of Embodied Labs. I'm also a public health educator by training and a medical illustrator. And so in my short introduction today, I want to tell you just a little bit more about my story of how I started Embodied Labs. For me, the seed was planted unbeknownst to me that it would turn into a company many years ago when I was in my teens. My mom got diagnosed with early onset Alzheimer's disease and in her late 40s. So as I was going through my career and then eventually became a home care provider to her family caregiver as really my job for several years in my 20s, my eyes were just open to what it means to get older in our country, issues that we face as, in my case, a family care partner, and eventually with the home health aides that came to help my mom and my dad and my family take care of her as she progressed with her Alzheimer's disease. And so at one point I was at home with my mom and I was interviewing and looking for home health aides that could help support me in taking care of my mom with things like bathing and dressing and just daily living tasks. And my mom happened to have, in addition to her Alzheimer's, she had this left visual field deficit. And so it meant all these things for her health, but it was such a mouthful to explain to everyone, you know, my mom has a left visual field deficit and here's what it is. It's not like she can't see like this, but, you know, all these words. But I made what became, this is our earliest prototype of what Embodied Labs does. But I would have us all wear goggles like this, where basically just the left halves are taped off, and we could step into my mom's perspective and immediately understand what she was seeing and why it was that if we approached her from the left side versus the right, she wouldn't be able to see us and we would startle her, or why we always had to remember to protect this side of her body. Or one of the biggest ones was at mealtime, she would eat exactly half of her plate of food. So if she was going to finish her food, we'd have to remember to rotate the plate. And so by stepping into her perspective, we could understand her health better. We could empathize and see through her experience. And then we could improve care practices immediately. And so these goggles made me wonder, you know, there's just so much more to someone's health condition than just a pathology, a simple visual change like that. And so later on, I went back to graduate school and I was working on this degree in medical visualization. Really love this idea of storytelling and visualizing health as a way to cross-cut cultural barriers and race and language barriers. And what I discovered in grad school was that using a VR headset like this could let us do so much more than what the goggles did. It could let us create 360 films and combine those in a game engine with interactivity. And then I was learning about the science of all of this, and, you know, simulation, while a headset like this has come on the market in the last, you know, now just over 2 years, we know simulation is such an important way to learn by actually training our brains through embodied cognition and embodied learning to interpret what happens in the headset as having happened to us in real life. And so we're able to learn, some research shows up to, you know, 4 times as fast compared to the same information in a traditional setting, or 90% more retention of what you learn in the headset compared to a traditional method. Yeah, so what we do today is we create experiences where healthcare providers, whether it's students at their universities or staff that work at a senior care organization, municipal government, social workers, even corporate employees that have products that serve older adults, they're able to put on the headset and they're embodying different things that impact us as we age. And you can see here that not only are you living through someone's experience, like on the, I don't know, your right, my left of the photo, you actually see this black spot, which is macular degeneration, and how that plays out in a live action film where your hands are projected as who you're embodying. But you can also step inside the brain, like this visual behind the woman on my right, I think your left, where she's inside a neuron forest and she's learning what Alzheimer's disease looks like as it builds up in the brain. And then she'll actually go into the experience of being someone who's grocery shopping in the store or with her family at Easter dinner. Or like this body you see in the center, we have a lab about end-of-life conversations. So how do you actually live some of these really tough scenarios out that could really impact all of us as we grow older? But the VR simulation trains us to be better prepared for them, whether it's in caring for someone who's going through those things, or even for our own lives as people who may face these as a family member or part of a care team, or even eventually in our own lives as we age and experience these common things that can impact us. I'm just looking forward to learning more about the audience and answering questions. And thanks again, Immersive Kind, for inviting me to be a part of this today.
Thank you, Karen. You know, what I'm really excited about is just actually finding out, which we'll discuss later, the future of VR and medicine. Your work is so inspiring. So thank you. Before we go to the panel, we're going to go now to the other side, to someone who's from the creative sector. So I'm going to bring Georgia up. Now, the reason why I'm introducing you to our guests in this order, because one of the most important things that's come out of this time is this need for very interdisciplinary collectives. So we're going to bring our next guest up, which is Georgia. Now, Georgia's an artist, a VR designer and environmentalist. Her work is absolutely incredible, which she can tell you more about when she joins us. We found that what's been instrumental to sort of rapid innovation, especially around PPE, is we found talking to people who have been working in these environments, is actually been having creatives embedded in with the scientists and technologists to think really creatively around how do you, for example, 3D print face masks very quickly, or as Carrie showed us, actually being able to create virtual reality films needs a creative as well. In fact, I will leave you to talk about your own work, because I just wouldn't do it justice. Please do check it out. Georgia, if you give us your Instagram handle as well, or if you go to Immersive Kind, you can find that.
I might just write it in the little comments bit as well.
So Georgia, can you explain a bit about your work and how it's changed in response to this time?
Yeah, of course. So hi everyone, thank you for having me. So I'm Georgia, I'm an environmental artist, and I use virtual reality in particular at the moment to sort of raise awareness of environmental issues and immerse people in environments that they wouldn't otherwise be able to experience. I use virtual reality as an educational tool mainly, but also it's a way of me creating my own spaces, which could be anything from like a tropical environment to just your everyday sort of like woodland, and then put people in that space and sort of force them to fully experience what I choose them to do. This is from my most recent piece, which is called Conivio, which looks at, in particular, plastic pollution in a tropical environment. Sort of in an island location. It compared, like I wanted to compare both pollution and a non-polluted area, so that people are aware of what they prefer and also what could happen in the future. So this is all created using Unreal Engine and 3ds Max as well, and I sometimes use Photoshop for the textures. Let me just have a flick. I'm not sure what comes next. So this is another image of the environment. As you can see, like it's a natural, like it's an island, a natural environment, but with the rubbish all like piling up. So as a good comparison to the two. So for me, during coronavirus, I'm really interested in how, even though the ecosystem has had chance to sort of heal itself and begin to recover from a lot of things. I mean, looking at like air pollution has reduced significantly as well. There has also been a massive increase in single-use waste, such as obviously like disposable gloves, masks in particular. I read an article this morning about how currently there are potential that masks will already outweigh jellyfish in the ocean, which is very scary. And I think it's something that people need to start to think about. And that's where virtual reality is very important, especially during these times, because it's a way of me putting people directly in these environments, because people don't care about things they can't see. Unfortunately, there's always this like seeing is believing sort of stance. And I think if you can, even if it's a designed environment, obviously in a way a designed environment's better because I can make it as extreme as I want to. It's like a first-hand example of marine pollution. And this is a projection of the virtual environment on top of it, which I've included in my exhibition. And so I'm really interested in not only using virtual reality and other technologies, but also how you can create quite immersive spaces outside of wearable tech, especially, again, during coronavirus, there is this thing with wearable tech of whether it will be allowed to sort of be used, because obviously the hygiene risk. That's the basis of my work. For now, there are lots of other things I'm starting to look at, especially as well. But yeah, thank you. I look forward to answering any questions you have.
Brilliant. Thank you, Georgia. And thank you. I wanted to put immediately in the lineup of people introducing their work, a scientist and a creative, because actually what we're seeing is these two things are blended. And, you know, especially the students out there listening, it's a real call to action that you don't necessarily have to study science to end up being a scientist, and you don't necessarily have to study arts to end up being a creative. So that's my sort of, you know, for wish to you to think on that. So next up, we're going to plow on, and we've got Genia Fretti. So she is founder, a geneticist like I was originally, and founder of My Life IQ, which does amazing genomic testing. So we're talking now about personalized healthcare and personalized medicine. So Lucy, if she could bring her up, she'll explain a bit about her incredible work.
Hello, can you all hear me? Yes.
I know. I'll leave you to explain your work. I'm sad that you don't have the. Last time me and Gina spoke, she had the most incredible board behind her, full of post-it notes and diagrams, and it looked like the most sort of extensive, important thing I've ever seen. But yes, Gina, I will leave you to explain your wonderful work. And thank you.
Thank you. Thank you so much. I appreciate it. Thank you to the Immersive Kind for having me. It's a wonderful to be able to talk about all of the things that we're doing and hear about everyone else and their work. My name is Gina Fioretti. I'm the founder of My Life IQ. I am an epigeneticist, which is probably a lot of you here know, but it's aligning your life with your DNA. Epigenetics is the life that goes on around our DNA that can influence how our genes are expressed. I spent my life connecting dots in terms of health and wellness and life, and I started by studying biology and biochemistry, but quickly realized that there were so many other things in the body that needed to be taken into account when we looked at how things are influencing the entire being. Everything in our bodies, they're connected. I kind of relate our bodies to petri dishes. So if you kind of introduce a new thing, then you have all this, environment shift. And we had to kind of think about how everything is connected. Once we add a new variable, there's a domino effect, and sometimes we don't know what it is that can influence, a disease or a different health trait or characteristic. So it's important that we take all of these things into account. One of the examples I give also is our bodies are like houses with bad electrical wiring, and you turn on a hairdryer or a new coffee machine and you see a light flicker in the other room. And what happens is that light is redirecting energy and attention and focus over to power this appliance. And the appliance could be anything from the wrong medication, the wrong exercise, the wrong sleep amount for you. Everything is very personalized because we're all very different. And everything downstream from that light bulb is now which was relying on that light bulb to function at its best, is now also diminished in function. And so to go backwards and kind of fix what the root of the issue is, so that all of the lights and all of the lamps and all the electricity is actually powered up to its greatest and not diminishing function anywhere across the body. So it's really about optimizing everything about your existence. The compass is one of the best inventions, the most incredible inventions we have in history. And My Life IQ is this platform that helps you navigate health the way that a compass helps you navigate your environment and your, just kind of your geographical location. It's all about making everything very easy and accessible and fun, because genetics shouldn't be so hard, and neither should reading blood work or understanding what's best for you. It's very personalized. So we're taking personalized and precision medicine to a different level and really putting it at the palm of your hand, because the minute you leave your doctor's office, you don't know what to do. And no matter how great the information could be or how moving it was when you were with your doctor, your healthcare provider, you go home and you're like, wait, what do I do now? And you look online, and population-based medicine doesn't work anymore for our population. It was based off a very long time ago, and we have a new population that we have to account for. So My Life IQ is making everything fun and puts it into your hand. You have the power. So.
Brilliant. Thank you, Gina. I think that's such an inspiring message for everybody out there. That I work as a futurist, not because I predict the future, but because I hopefully enable people to create the future. That's what it means to me, by giving them that power. And I think personalized medicine is so important, especially in this day and age. And personalized medicine is about empowering yourself as well. So I can't wait to talk to you about sort of the idea of epigenetics, what even this time is going to do to our epigenetics, the legacy of it, and how we can protect ourselves against that. Next up, I'm going to bring Henry up. Now, Henry Pinchback is the founder of 3D Life Prints UK, which is a medical printing company, which actually, as we know from this huge need for PPE to be printed very, very quickly, he's been very instrumental in understanding how that's done, but how that's done safely as well. Because I think there's been a lot of flack around, regulations that slow us down, but also regulations are very important to ensure that we're safe. So Henry, welcome. Thank you for being here today. I'm going to leave you now to explain just a little bit about the amazing work you do.
Yeah, sure, no probs. Thanks for letting me be here. Also, it's really nice just to be the only man on the panel. What a nice change that is. It's normally absolutely the other way around, and it's really refreshing to come on a panel like this and be in the minority. That's actually totally cool. I'm totally down with that.
Really?
So I'm going to tell you a bit about me, and I'll tell you a bit about my company that I set up 5 years ago, and which is called 3D Life Prints. I'm the CEO of it, and I started off my career, I suppose, my training. I started off as an ecologist, but then realized there was no money at all in ecology. So then I got into law, and I was a lawyer for 15 years, and there was loads of law, loads of money in law, but there was no fun. And it certainly isn't very good for the soul being a lawyer. So then I got into healthcare and started running healthcare businesses. And this is, and maybe after this, I'll get back into ecology, who knows? But I think that I found my niche running little businesses, which is the thing I love the most. So 3D Life Prints is my company, as I say, formed 5 years ago. So 3D Life Prints is a medical 3D printing company, and that kind of sets it aside from other 3D printing companies in the sense that I hope we can see. Hold on a minute, I can't see here. I actually brought some of our little tools here. So we make things. See that? So that's a foot. Yeah, very good. And some other foot, jaws, various other bits and bobs, parts of the body. So the difference between with a medical 3D printing company is, rather than a CAD file or designing something as your input data, we use medical data as the input data. So that means that, I'm just going to do myself up a little bit. That means that we get a DICOM, so that means like a CT scan or an MRI scan, and we take that selection of slices of data, and we use those to create a personalized medical device for the patient. So you were just talking about personalized medicine. Ours is like the physical embodiment of personalized medicine. So when I showed you this foot here, you see this isn't just a foot, this is somebody's foot. And as you can see, it's actually got the person's details on the back of it, because this comes from a patient. And when you kind of put those two things together, you get something really powerful, in the sense that you can start using 3D printers, which are really kind of personalized manufacturing machines. And now you've got a really personalized personalized file to print from. And I think that 3D printing is really misunderstood about what it does best. Because I think if people are printing PPE on it, it's nice, and we'll get on to how it can be good in the short term. But in the long term, yeah, that is actually somebody's foot, yes. In the long term, I think what 3D printing should be used for is personalized, individual things, something where you want one of something, not 10 of something, or 1,000 of something, or 1,000,000 of something. For example, when we're printing these face masks or face shields or the things, you need them in huge quantities, and therefore the unit price, if you're going to make them on a 3D printer, is really high, sort of £3, £4, £5 each. Whereas if you make them in a traditional manufacturing, you can make them for pennies each. So while it might solve a short-term problem, printing thousands of things, actually it's not a really long-term solution. But where we work in our particular little industry is making patient-specific medical devices. So this here is somebody's foot. And if you can imagine, this person here had I believe had a horrible accident and has a lot of these bones here are broken. I'm not medically trained. I don't know anything about this. My employees do.
That's a 3D print exact of his foot.
Of his foot, exact of his foot. Every single part of that is of his foot. I mean, only the bones are there, obviously, but obviously we stripped away the other parts and just printed it.
Oh, so that's it. Okay, I see.
Yes.
I was like, is that actual bones, or is it it's a copy of the bones?
This is a copy of the bones. This is made of plastic. It's not somebody's foot. It is somebody's foot. It's a copy of somebody's foot. Okay. And you imagine if you're a surgeon and you want to perform an operation on somebody's foot, and it's really complicated, and you're going to look at some scans. What's better than to have the foot in front of you, so you can actually do the operation before you go in the operation? So that's the basic premises of our business, is providing surgeons the tools that they need in order to personalize the surgery for the patient. And actually, this is kind of product number one. And we didn't invent this, I have to say. There's been a few other companies that do this as well. We just wrap it up as a nice service. But if you imagine, if you're going to make a copy of someone's anatomy, you can actually make an implant that fits someone's anatomy. So rather than having, as you normally do with a hip replacement, is they get a size number 33 hip and they chop some bone away and they fit the size number 33 in there. You actually fit something, you make something that fits the patient's anatomy. And that's a really big change in medicine. in the sense that you can stop having a standard fit device for individual patients, and you start having individual devices for individual patients. A huge change. This is like a sea change in medicine as I see it. And the question is, why wouldn't all medical devices be individualized, right? Why wouldn't you have that? And so therefore, the whole job of my company is to make these technologies more available to hospitals in the UK and to patients in the UK, rather than being completely priced out the market and only being available in private healthcare. So this is kind of 3D Lifeprint's mission, enable these great suite of technologies to come down into the real world and start affecting patients now. And we do, we're set up in 3 hospitals around the UK. We're providing patient-specific models, implants, guides, all the time these days. So
Brilliant.
That's us.
That's absolutely amazing. Thank you. I'm still slightly disturbed about that foot. I know that this come up in my head is who actually now owns that foot as well.
Good question. Yeah. Well, I can. It's a bit of an argument.
Yeah.
But,
I'd own my own foot even if it was a copy of my book.
So what happens is either the patient or the hospital owns the scans, because that's very clear, right? They give me the scans, and I create a different set of scans and software and a file from that. Now, there's the real argument: who owns the file that's been created out of the scans? Now, this thing here, the actual physical embodiment of it, the hospital buys back off me, so it ends up being the hospital's. But for a while, it's mine until they pay me. So the patient here is in a really funny position because they've signed up to get their scan taken, but they probably haven't signed up to have their foot reproduced. So I'm very, very careful about what I do with all this data. So all the data that comes to me, I give it all back to the hospital.
Yeah, well, that is very good, and that's something that we will discuss later in all of this sort of data security, privacy. So thank you, Henry. I can't wait to hear more about that. So last but not least, so I'm having my mind blown here. So we've gone from VR technology right through to VR creative art to explore the issues involved, to epigenetics. How can you personalize your healthcare solutions? How can you physically personalize your healthcare solutions? And last but not least, we've got the wonderful Sarah Zanakatoni, who comes from us, who's in America at the moment. Now, she's been absolutely fundamental to support the NHS Hero initiative. But on top of that, she's also an amazing qualitative researcher. Sarah, hello. And she looks into health aid for vulnerable people, because something that is incredibly important in this time, and we hear a lot, this time has been incredible because it's digitalized everybody and it's accelerated innovation and digital technology. But the one thing that we must not forget is that we can't leave people behind. And if we're going to progress as a society through this with technology, we need to make sure that people have access to that technology, that it's made with everybody in mind. So, Sarah, I will leave you to talk briefly about yourself, and then we'll bring everyone up for the discussion. So, yes, Sarah,
thank you, Catherine. That was probably a kinder introduction than I deserved, but I will absolutely take it. And I will keep my part of the presentation very, very brief, because I am excited to move on to the interactive phase and hear much more from my amazing co-presenters. So just a little bit about myself. I'm an anthropologist by training. My background pre-COVID pandemic, in that world we all used to inhabit, is that I was an HIV prevention specialist. So I was specifically working with governments and healthcare systems to figure out how they could better target their services to women, and normally to the most vulnerable women. I was supposed to be spending this year in London doing a fellowship at the London School of Hygiene and Tropical Medicine. But then when the pandemic hit, it really was not enough to just be doing desk research for a year. So I was very lucky in that I got to join NHS Hero Support. So anyway, the point of NHS Hero Support was to be an emergency pop-up service. And we raised over £125,000 to distribute 500,000 items of PPE. The organization was volunteer-led, volunteer-driven, and volunteer-staffed. So everyone from the organizers to the people who were purchasing the PPE to the people who were distributing it received no money for their services. This was all done out of the goodness of people's hearts. And because of that, we very much knew that it had to be a short-term effort. We were always intended to be a temporary measure until the UK government could really get to task in sourcing their own PPE. We figured that the guidelines to keep people safe were there and correct, and we just needed to wait for the supply chains to catch up. I think it became harder and harder to believe that that was the full and complete and true story as time went on. And that's not to criticize the government. I think they have done, I think they have been in a really unenviable position. But as we were starting to do more work, as I was starting to do more work in NHS hero support, I was looking more into the care sector. And one of the things that you will see if you look at the data on the care sector is that carers are dying at twice the rate of doctors in the NHS from COVID. And a large part of this is because the only recommended PPE that the care sector gets are masks, plastic aprons, and sometimes face shields. And I want to pause on the plastic apron there because this plastic apron has absolutely no sleeves. It's something you tie around the neck and then tie around your waist, and it protects your torso, but there's certainly nothing on your arms. So carers were going throughout their day, lifting patients, dressing patients, changing patients, generally caring for the people they loved with bare arms. And we know that COVID is a sticky virus. It can stay on your skin. It can stay on the hair on your skin, just waiting for the moment in which you touch your arm and then touch your mouth or touch your eyes, which meant that we were leaving those most vulnerable to infection entirely more vulnerable. Not only were we asking them to work with elderly people, people who were at a higher risk of developing severe forms of COVID, but we were asking them to do it without giving them the proper protection. So I was lucky enough with a couple of other hero support people to start a project called Cove Sleeves. We're creating a fluid-resistant, long-sleeved garment that can be washed and used multiple times, and then will be used in the care sector. I lead the discovery team on this, and I'm going to explain exactly what that means in a minute, because I've had this continual question from people of like, oh, you're an anthropologist, like, what are you doing in the design space? That's not generally what that work does. But I've gotten to design a process that makes sure that these gowns are not only sustainable and safe, but they're designed with carers in mind. We've got people with us from the English National Opera. We've got material scientists from everywhere from the University of Sheffield to Toyota UK. And then you've got me, who's kind of sitting in the corner, expounding on the need for social science. And I'm going to argue that I'm not biased on this fact. I think you should always have a resident social scientist on your team.
Yeah, agreed.
I appreciate that I'm in a group of people who agree, because that's normally a really controversial statement. But I'm going to give 2 reasons why it's critical to have an anthropologist on board when you're doing these things. So a lot of my day is spent doing ethnographic interviews. I speak with care workers about what their typical day looks like, what their fears are, what their hopes for their jobs are, what their thoughts on the sector are, how they feel about politics in the sector, how they feel about their supervisor. And on one hand, that's a very practical thing to do. We're not carers. Nobody on the design team has necessarily worked in the care sector for long periods of time, so we don't know what the day-to-day life of a carer looks like. We need to make sure that we have a garment that's going to fit those specifications. So for example, one of the things that we were repeatedly hearing from care workers was that it was incredibly hot to work in the sector. Even in 1 layer of clothing or 1 layer plus your little plastic apron, the buildings were kept at warmer temperatures to make the older residents more comfortable. And the work of caring, the lifting and the changing and the moving people around, is going to leave you hot and sweaty. You don't want something else extra on your body, even if it's going to keep you safe, if it's going to make the day completely intolerable temperature-wise. And hearing that has allowed us to change what fabric we're thinking of using, how we think of where the fabric ties, how much of the body is covered by fabric, how much heat are you trapping in versus how much of the skin are you letting breathe while still keeping people safe. Now, that being said, I will acknowledge that those discoveries don't necessarily have to be done by a trained social scientist. Those are things that probably would have come out if you just asked people, what would you like your gown to look like? One of the more critical areas, though, in making sure that you have a social scientist on board when you're doing this work is that you're introducing a brand new object into an environment. Carers have never had long-sleeved garments before, even if these garments are going to be more protective of them in this pandemic. And we don't necessarily understand the culture that carers have around personal protective equipment. How do they think about wearing a mask or wearing a visor or wearing a gown? How does that make them feel? How do they feel that that affects their work? These sound like more intangible questions than just what would you like your gown to look like or how would you like your gown to behave? But they're equally as important, because if you give a new object to someone and you don't bother to explain how that is going to fit in their working environment, they're probably not going to use it, even if it makes all the sense in the world to you as the designer why they should be using it. I'll give a very brief example before we get to the questions, and that is that we encountered this problem very early on of what safe meant when it came to the arms. We always assumed that safe would be a completely covered arm. The virus cannot stick to your skin. When you take off the gown, you know that any virus is trapped on the gown and it's not getting on your body. This was not what safe meant to a lot of the carers. To them, safe meant washed. If you didn't have short sleeves, you couldn't be washing your hands and your lower arms continually. to get not just COVID off, but any pathogens you might encounter throughout the day. If someone had if one of your patients had a gastrointestinal issue, if they were fecally incontinent, you didn't want to worry about pathogens or material from that getting on long sleeves. So many of the carriers didn't want to wear a long sleeve gown at all. And figuring out how we could explain to them and work with those suggestions, and also adapt those suggestions for a COVID world, a world that they had never encountered and we had really never encountered until about a couple of months ago, was critically important to having people even willing to adopt the gowns. I'm going to close there. I'm more than willing to speak about any of this, and thank you for letting me be here.
Thank you, thank you, thank you. I'm now just seeing if I can untoggle myself, which my computer's being very slow. But I love that, and I think it is something we often forget. Now, we've heard from, like I said, an anthropologist, we've heard from epigeneticists, we've heard from 3D printers, we've heard from artists. I'm actually going to bring back, I'm going to give them time to prepare. I'm going to bring back up Carrie and Georgia, just to actually, because it follows on quite nicely from what Sarah was telling us. So what we want you to see here is actually we're moving into an era where progression and innovation is about collective perspectives. Like Sarah said, you need an anthropologist. She had people from the International Opera to look creatively around these problems and challenges. And technology is a real driver of that. Carrie, hello. And hopefully Georgia will come up as well. The reason why I'm bringing you up from this is because you guys are the ones using possibly at the moment more creative technologies to explore the issues and problems. And the question which has actually come up to the top, and then we'll bring everyone back. So start asking questions now, is actually about VR technology and how this need at the moment for rapid innovation, this need to think outside the box has actually accelerated the use of VR. Can you tell us a bit about how it's accelerated in your world, the use of VR?
Yeah, so when COVID hit, a big part of our customer base are people that work with older adults. So one of the most vulnerable populations that is impacted by COVID is who we've been working with to train up their workforce. And, not related to VR, what we saw due to restrictions of visitors in senior care homes and needing to social distance and shelter in place, telemedicine became huge. So we saw places that hadn't really adopted any kind of telemedicine infrastructure do so within weeks out of necessity to be able to get their older adult residents in their communities connected with their doctors and their family members. And so all of a sudden with COVID coming on, this idea that the time was yesterday to be ready for telehealth hit all of these groups. And then people who thought, I can't use Zoom, I just can't do technology, found themselves having to use technology. And so I think COVID's really helped people see why now is the time to think about how technologies can accelerate our work practices. And so while VR is a little bit behind where maybe a telehealth platform, a video-based platform is, I think it's gotten the groups we serve and are curious about it more ready to say, more than ever, we need efficient ways to train. We want to cut down training time by 75 to 90%. And we need people, like what you were saying, Georgia, we need people to experience environments that they can't otherwise experience. And I've just seen more creativity from who we work with to say, oh, what if we could train with this kind of experience or use multiplayer experiences. So it's really opened up people's creativity in imagining what immersive technology can do and why it would make their workflows more efficient. I have a couple other thoughts about it, like from how it accelerates training in the long term, but I'll stop there so that Georgia, you can answer and keep it in.
Thank you. Yeah, and so from the other side, I say the other side is if like art, science and arts are on other sides. That's my training. I've got to get that. So my cultural conditioning. From your perspective, Georgia, how has VR do you think this time will accelerate the use of things like VR?
Yeah, I mean, one of the things I noticed in terms of the use of VR is people sort of seeking escapism during this time, because obviously everybody's quite feeling quite entrapped, especially with lockdown. And I've also spoke to quite a few different companies that have suggested, like I said before, about using VR for like an educational, and quite similar to what Carrie said about like training people, It's just an easier way of connecting to people quicker. I think obviously using Zoom's great, and using video calls is great to connect people, but I'm sure everybody here has maybe muted themselves on a meeting or got a little bit distracted and not quite, and it's a harder way of connecting people and keeping people focused. Whereas using VR, you can have a 3D environment, you can choose whatever environment you want to show, you can be there as, like you said, like multiplayer as well. And obviously then that means that you could focus on something like a task at hand and do it as if you are actually there. And I think it will massively, I mean, on an environmental side, massively reduce the need to travel, which is a great environmentally, because there are so many people that travel unnecessarily for like an hour meeting, and the pollution from that, I mean, has already started to like reduce. So for me, I think that's probably the biggest change. The need face-to-face contact is essential, but obviously VR is the next best thing, and you can fully feel as if you're with somebody through VR as well.
And I think that's a really important point, actually, which goes down to sort of, you know, this idea about digital accessibility and what should the government be thinking as a policy about who can access these. I mean, one of the reasons we're using Crowdcast is you can use it on your mobile phone, and there's a section right now. Everyone goes, oh well, everyone has a laptop, but they don't at all, not at all. So how can we make these technologies accessible? I'm going to bring Gina up if she's there. Let's see, they're all sitting in the audience. This is great. It's like virtual space to actually ask this exact question, because obviously personalized medicine is wonderful. But actually, what are the ethics? It's the question that's come up. Actually, what are the ethics around this research, sort of ethical burdens, ethical restraints? Oh, Gina, she's no. Can you hear us, Gina? Hello. Well, that's one of the questions that's come up really high in the polls, which sort of leads on from this, is: are there any ethical burdens that affect your research, or ethical considerations, either now or moving forward?
You know, I've talked a lot about how, you know, they're going to be in HR or in certain employee, you know, environments. People are like, oh, well, I don't want anyone to know about my, you know, genetic information. And we don't have a whole lot of protection around it yet because it's still relatively new. There's a small, it's actually called the GINA Act. It's the Genetic Information Non-Discrimination Act. And it prevents insurance companies and employers from discriminating against your genetic makeup. But, you know, we don't discriminate against people who have cancers, right? And so when you're talking about just diseases and, you know, I mean, coronaviruses or anything else, it's not about discriminating. It's about empowering and then creating tools and resources and just the different platforms and programs to be able to support those things. It doesn't, you know, you're not bad or wrong or, you know, should stay away because you have a certain ailment. It's just a matter of mitigating it and managing it the right way.
Yeah, agreed. And I think that sort of, and it's something just to be aware of. I think, you know, there are no right and wrong questions, you know, answers to these. There's no obvious answers, but it's things to be aware of. I've suddenly noticed quite amazingly that we're all women. You know, sorry, Henry, on the panel, and it's something we've got a lot of women, female students with us. So while you're all here, one of the questions that has come up is how do we, you know, how do we get more women to interact with science, technology? You know, any tips from your past, how you got to where you are right now? Any challenges or things you would like encourage yourself as a female in this space at sort of 17 to do differently?
Yeah, I mean, personally, one of the biggest things for me was talking to other people who have done something similar. So contacting other women who have gone to where I've wanted to go or done things that I've wanted to do, and sort of make sure that you're not afraid to network and not afraid to talk to lots of new people and different people, because you never know where meeting somebody could lead you. They could introduce you to someone else. And I think it's really, really important that the more women who especially work with technology, the more girls will look to do that as a thing. Because I know when I was at school, that wasn't even a possible career, and it wasn't that long ago. I mean, I'm not that old. So I think it's important that people continue to sort of push it and encourage girls that they don't just have to be, you know, the girly roles. There's loads of these male roles that they can fulfill.
Yeah, absolutely. Carrie, Gina, any tips to the female students out there?
Yeah, I didn't know that I would found a company. It was something that kind of snuck up on me in that, yeah, I right time and right place, and that I had co-founders that wanted to go all in and had fallen in love with the start of our idea that turned into the company, now celebrating our 4-year anniversary this month. And I would say when I started the company and I was the CEO, it almost sounded funny to me. Like, how could I be a CEO of a company at 28 when we founded it? I'd say to all the women in the audience, we need more women to found companies and be CEOs. And it's okay if it doesn't feel right at first. Now I feel more like a CEO than ever. And when I realized that only 2% of all the venture capital dollars, the billions of dollars that go into investing in new tech companies, though 2% go to women-led businesses, I realized that we have to have more of a share at the table. So a big part of what I do now, in addition to build embodied labs, is really advocate for women being invested in and growing big companies with big unlimited visions. And there's still just such a huge need for women to be able to be heard in their authentic selves as the way that we as women lead, which looks different than what we've had in the past.
Brilliant, thank you. Yes, I mean, I echo that. I was a scientist working in labs for a long time, and people asked me what I did, and I said scientist. I'd laugh afterwards in this slightly apologetic way, because when I was younger, I was doing lots of arts things and scientists with these people in lab coats, and that wasn't what I would do. I was just interested in stuff. That's how I ended up in labs. I wanted to explore. It took me a long time to stop, to actually sort of not feel like an imposter. Gina, I don't know if you've sort of struggled at all to get to where you are.
I absolutely had. It was funny when I first started with my, can you hear me? Hopefully, yeah. When I first started with my old company, I had a couple of different mentors, and one of them told me that I had to look a certain part, dress a certain way, not really, not be pretty or not be, funny, or just kind of be forgettable, which is really sad, because it's like you're allowed to have a personality and also have a passion and a good background in education. And Carrie, what you were saying about VCs and different funds, thank goodness there are so many more that are focused on women-run companies and CEOs, and I'm hearing about them more and more as I'm still raising funding, because there are all these big projects going on all the time. And so it's very much, it's nice to see that finally. I think it's been 15 years or so since I started my last company, and it's changed dramatically since then, which is refreshing.
Brilliant. Yeah. Thank you. I was going to say, and that's the positive thing. Things are changing, which is why it's wonderful. I feel I should, after just going to Wonderful Women, bring Henry back up to say that we do also need the male perspective as well. Although someone said never worry about having panels just of women, because until you've had hundreds of years of panels just of men, it's okay. But I think it is important to know that, and to know that all of you are working in very exciting spaces, technology, and there wasn't you forged paths that weren't necessarily there. I think that's a very inspiring thing as well. There's the professions that we see that you can easily get to, and there's ones where you have an idea and you forge that path. So to everybody out there, students, do forge those paths, do chase things you're very passionate about, and be really brave about it. And starting startups. I'm going to bring Henry back, which I don't know if we can have us all up here at the same time. Someone might get bumped. I'm really apologize in advance, because one thing I'm quite interested in asking him about in all of this is that everybody here has been working in a space of innovation, and everybody here has also, one down, been working due to the pandemic at the moment in COVID. That innovation has been accelerated, and something that's been very interested is how do we maintain that acceleration of innovation with all these collectives. Now, this has been and all times of crisis are great for medicine because we're allowed to sort of experiment and we're driven to push this. And I've seen these incredible open innovation ecosystems. So my question really to you, Henry, is how do we keep these big collectives and innovation ecosystems plowing forward, but also at the same time, you know, have regulations, stay safe? Is there a balance we need to be wary of as we catapult forward?
Well, first of all, I should say apologies for bumping off a woman off the screen. Not the kind of image we're trying to give here. It's not at all my intention. But, yeah, so sorry about that. But yes, it's a really valid question, I think. And my previous career as a lawyer, I it's the thing that scares me a lot, probably more than a lot of people in the additive manufacturing world, who think about regulations and kind of risk as something that's kind of further down the line and not really their problem. But I think it really is their problem, and it's a real, and it should be borne in mind. You know, if you give someone a 3D printer, it enables them to make stuff, obviously, duh. But the question is, should they make something really? You know, just because you have the capacity to do something doesn't give you the God-given right to go and do it because it's a good idea. And I'm particularly thinking about the medical sector, of course. And with PPE, we saw this funny conflict. And I mean, I was personally conflicted about it because I saw these amazing stories. We've heard some today about collectives of people providing amounts of PPE where they were absolutely needed at the point of care, in situations where they were desperate in hospitals. And, you know, at that point, the should is probably weighted towards, yes, you probably should do something. But if we're talking about products that are a bit more technical, and I'm thinking of here, there were some products to do with, if you remember, there was a scuba mask that got turned into some breathing apparatus. And some of the 3D printing companies in Italy, and actually we were asked to do this as well, created some parts for those, or even some parts for some ventilators. Now you've moved there into this world that you're thinking, whoa, this could actually cause a whole heap of trouble. If you miss 3D print that, or use the wrong materials, then all of a sudden you can cause a whole lot more damage than you're intending to solve. And so when we looked at, we were asked all the time to print stuff during the last few months, interesting things. The first thing we thought as a company was, first, do no harm, right? Take that as your principle. First, do no harm. And if you're not sure if you're going to do some harm, stop. Because just because somebody in a hospital is telling you to make something doesn't mean you necessarily should make it, because they are not experts in some cases. And so we refuse to do quite a lot of stuff. Obviously, the risk there is they just go around the corner and get someone else to make it, and that's even worse. So I think there's a huge risk here about regulations, and I don't think actually the government did very well. In America, there was America Makes, if you know the organization, they gave some really clear guidance about what sort of things different people should be making. And the UK government did that about 2 weeks ago. You know, kind of the horse is out the door and bolted by that stage. So I think that it's incumbent upon the people who run bureaus, and even anyone who has a 3D printer, to think, should I be doing this? Not just, can I do this? And, you know, the medical device regulations are there, and they're there for a good reason, honestly, because you can hurt a lot of people making the wrong thing.
I think that's a really good point. I'm going to note to the audience that it is 6 o'clock, so we are going to run on for about another 10 minutes before we go to session 2. But if anyone needs to leave, we probably won't notice, but we definitely won't be affected, because we understand that people do have some things to do in this time as well. But that's a really nice thing to think, you know, should we do it rather than, you know, can we? So I'm going to actually, Georgia, I'm going to take you down, and Henry as well, and bring Carrie and Sarah back up here for a second, because I think that's quite an interesting question to pose to them in their work. Sarah, because you're working with vulnerable people, and Carrie as well. And where do we find that balance? You know, and I mean, Gina as well, you probably have a perspective on this as well. You know, should we be doing this? I mean, there's a lot of ethics around genetics and what that means. How do we go forward ethically and doing the right bits of research?
I really believe that if you take everything into account, and you're acknowledging, that we may not know everything right away. No one has really gotten their whole genome tested, and even if they have, it's no healthcare practitioner can go through all of those things and say, oh, we know that every, all of this treatment is going to be the right one for you, or this, this implant, or this this practice. It's really about, as long as you, and it's in that step of do no harm, but it's also, let's do everything in the right direction, one step in the right direction, if even just one, not to try to make big, huge, massive, gains at one time, but it's just really about, having, even if it's a small step in the right direction, at least you're going the right way.
And I think that is something, so we had a question from Nancy saying, what are the challenges for the next generation? And Sarah and Carrie, I don't know, what do you sort of, and this could be in terms of who, vulnerable people. So thank you, Nancy, for this question. Or in terms of Carrie, there's been a lot of questions around, actually how you started your startup and overcome those challenges yourself. So Sarah, would you like to go first? What do you think the challenges are for the next generation?
I think we are increasingly breaking out of this paternalistic model of research in that, we as the researcher come in and we do whatever is best for you and we leave that with you. We are inching forward to a lot better collaborations and communications with the populations we call vulnerable, noting that they do have power often within their own communities, even if those communities are smaller and they don't have power outside of that. I think creating those partnerships in a way that doesn't just tokenize people, not just going and saying, okay, well, we listened to you once and we, wrote it down in our notebooks and then we went away and did something else, will be really important, because the field is at the point where it recognizes that it's important, and certainly the health field recognizes that it's important, but how that gets implemented is going to be very, very dicey.
Yeah. Brilliant. Agreed. And I think this is the time now of actually, they say the people are the most adaptable people who react to the immediate situation, but always thinking ahead as well. Carrie, do you have any thoughts on that? What the great challenge is, whether it's sort of for women in the tech space or just in general for the next generations are going to be?
Yeah, I think that one way that I've been flipping my thinking is thinking about people that are not represented as underestimated. So there's a huge value and return on investment, if we want to use a business term, of the people that aren't at the table, whose voices aren't being heard. They're underestimated, and there's value there, whether it's economic, social. I mean, there's so many ways to think about it. So I guess for the next generation to build on the momentum we've had that Gina pointed out in the last 15 years to get us to where we are now, I think it's looking at the next generation to say who's underestimated and how can we hear your unique voice. And now we have so many ways we can share our voice through social media, through all these different channels, and just encouraging the groups that aren't being seen to be heard and to be seen as much as we can. And through that, they will build all sorts of value beyond what the majority has done to date, because there's money there.
Yeah, brilliant. I think that's really important as well, and it's a good thing that you pointed out. Obviously, we're very aware of the immersive kind of the technical and digital divide, but the innovation that's happened right now, the innovation itself, in terms of PPE and how we face this challenge, have been because of technology, but the way we've done it collectively has also been due to technology. Even 10, 15 years ago, we simply wouldn't have been able to innovate together whilst being isolated and innovate globally as well. And I think that's really, really important as well. The sort of, and just looking at the chat here, Savannah's had some great questions for us as well. And, about how as different women being should to have a voice in all of this, especially when there's very contradicting ideas. It's very hard to find your way in this. And I think that's another piece of advice I would give to all the students out there. It's not an easy path. All of you here on the panel, I guess, would you have ever thought when you started out you would be sitting where you are now? Or did you always know this is what you were going to do?
Didn't know this was what I was going to be doing this time last year. Like,
I think that's a good point as well. Yeah, you know, things change, and just go out there and explore. So to bring it back to the question, so we've discussed women in technology, we've discussed technology itself, and thank you to Samantha for the question about ethics, because I think that's actually a very, very important one. Before we sort of wrap up, coming back to the overarching theme was the sort of disaster preparedness kit, and we think speculative futures is very important. And I'm going to ask you each, and then I will bring the two people who are sitting in the audience still back on. If there was one thing you could put in your disaster preparedness kit moving forward, so your imaginary kit that's going to take you into the future, and it's the one thing you have in your backpack, what would it be? I answered this and I said a person, my friend. I don't think would do very well, but would have a good time. And then I realized she probably wouldn't be able to help humanity either. So, Sarah, I'll ask you, what would be in your disaster preparedness kit?
oh, so stereotypical ethnographic answer. I would have a tape recorder. It's one of my tiny little handheld tape recorder, because I think the conversations I've had with people, and that's not just, my research subjects, but like the conversations I have with anyone have been so beneficial in thinking about how do I do design, and how do I do social science, and how do I do activism, and what is the future we want to build together.
Yeah, brilliant. And probably lots of batteries as well.
Absolutely, lots of batteries.
That'd be one item. Thank you. And Carrie, what would be in your disaster preparedness kit?
Does it have to be something that exists yet, or?
No, anything.
I wish we could have like transporters, so we could do like the Star Trek style, like just appear places and hang out as holograms together in different spaces, and that tech already was built and works great, and keeps us in hologram form, germ free.
Well, I love the fact that you mentioned that if you wish it was already built, because of course we are moving towards that point, aren't we, where holograms with haptics can just drop in and we can all hang out. Using virtual reality, it was the first time I have ever had to I was lucky enough to have a headset, and I realized I'm one of those very privileged to have a headset, but be able to put a headset on, first time ever, to leave my own house. In fact, I went with a friend and we gate crashed a virtual party together, which is a sort of an amazing sign of the times. And one day we will all be able to access this technology. Gina, what would be and while we do that, I'm going to say Sarah and Carrie, I'm just going to take you down so we can have Georgia and Henry back up. But thank you.
Thank you.
For your
Thank you.
And Gina, while Henry comes back up to the stage, what would be in your kit?
This is not I do not intend this to be, drop on my company and go like, oh, this is, everyone should get what my life IQ. It's the platform that I'm building. I think that if we all knew, and it's really about the knowledge, right? So if you knew how you stood, where you stood with certain health, challenges or certain health conditions, you would be able to navigate your world a lot easier. You would be able to make the proper choices, and we wouldn't all have to be in quarantine. It's where do you stand and what's your risk, and then mitigate and manage appropriately. That's what I want. That's why I'm building it, right? Like that's what we do with our companies, right? Like you're like, oh, I want that thing, so that's what I'm going to go and do.
And I think that's a great tip of inspiration as well. For all those students out there, if you don't quite know what you want to do, think, what is the world I want to live in, and then build that world. That's a very strong way to move forward and just help society. So Henry, what is in your? Other than a foot?
Well, body parts, obviously. Yeah, need them. I should say a 3D printer. Because obviously I run a 3D printing company, but I don't really use 3D printers very much. I have lots of people help me use them, so I'm pretty rubbish at 3D printers. But I live on my laptop, right? And so without our laptops, how would we have all lived? I run my company from my laptop. I run my phone, honestly. And so I think that we're in a way lucky that all the tech has moved on far enough that we can all compartmentalize our little businesses or our collectives or whatever it is and run them from our homes. Because here we all are in our homes and not in offices. And basically it's because we've got an office in a box, right? That's sitting in front of all of us. So I think that the thing I have to have with me, because literally my life runs through this screen in front of me, in front of this laptop.
it's a laptop. Or I suppose people who don't have laptops, a phone as well.
Same thing, right? You know, whatever the communication device that's sitting in front of your nose right now, how would you have survived the past few months without it, right? Very difficult.
Yeah. And I think that's the thing. If this had been in 1995, we would all be stuck at home playing Snake on our Nokia. And
Happily.
I think it's in terms of human connection, I think the point there that's so important is what it has shown is this incredible need for human connection, and technology can be an enabler of that. And you know, that's why it's so important that everybody be able to access technology. So thank you. And Georgia, last but not least, what is in your disaster preparedness kit? Well, I'm hoping your audios are going to catch up, because I can't hear you.
No, I can't hear you.
Oh no, George, I can't hear you. Can anyone lip read? I heard you. I can lip read. Oh no, you'll have to write it in the chat, and we'll read it out in a second. Or if you could mime it, maybe we could interpret it. A badger. Yes, her best friend. Brilliant. Which leads exactly on to the point I made. You know, it's about human connection, and actually all of this is about human connection. I like that answer, and I hope that she'd be very good at, you know, hunter and gathering. So for all eventualities. But yes, and that is what's so wonderful about this technology. You know, we would not be here today without this technology. I'm going to wrap it up here because it is 1:15 and say, in fact, we can go now in a second to session 2. So in a second, you will see at the top of your screen where it says schedule, and you'll be able to click into this. Just a chat room where you can connect more with each other, because that is what we're all about, and that is what today was about, being able to connect with each other, to hear our incredible speakers, you know, tell stories of how they've got to where they are, how they have just faced this challenge of COVID and pivoted into amazing spaces. And you know, it's amazing to have so many women as well, and of course Henry, a man, absolutely. You know, wonderful chat going on. We've got Samantha asking, you know, how women are seen in the professional environment. So I suggest in a second we all go over to session 2 and continue chatting. But from my side in the Immersive Kind, please, students, fill out your polls so we can do more of these events. There's a second event in this series coming. We've got a round table. We've got, if you go at the Immersive Kind, you'll see the amazing Instagram, so you can connect with us all. And this is a collective, and it's about activism. It's about making change. And, you know, whatever stage you are in your career, whether it is still a student upwards, we want you to come and join us and keep these dialogues going, because that's what this is all about. So a quick thank you to all our amazing speakers, Carrie, Gina, Henry, Georgia, and Sarah, of course. And I'm going to suggest that we all now go to session 2. So I'm going to close this session and continue this conversation. Thank you, Kadeen. I don't know if you're in the audience somewhere. So she will come into the session as well as Chanel, Lucy, Jay, and the amazing Immersive Kind Collective. So thank you, everybody. And we will see you all in session 2. Thank you.
Bye. Thank you.
Bye.